Hello, welcome back to my channel. My name is Pharmacist Yomi. If you are new here, I film about faith, health and lifestyle. As you can see from the title of today's video, I'm going to be talking about painful period, medically known as dysmenorrhea. I believe every lady or every woman goes through this pain in their lifetime, and today I'm going to be taking you through the causes of dysmenorrhea. I'm going to be talking about the types also, and I'm going to be talking about the treatment. If you'd like to know more about dysmenorrhea, please make sure you definitely keep watching. There are two types of painful period. The first one is known as primary dysmenorrhea and the second is known as secondary dysmenorrhea. Now, talking about primary dysmenorrhea is the kind of pain that you feel when there is nothing wrong with the pelvic organ. Everything is working fine. You could feel pain at the lower part of your stomach. You could even feel pain at the lower part of your back. You could feel cramps. And talking about feeling the pain at the lower part of your back, this is known as referred pain. Now, what is referred pain? Referred pain is when you feel a pain in a particular part of your body and the source of the pain is entirely different from where you feel the pain. For example, painful period. The pain is actually coming from the uterus, but you eventually get to feel the pain at the back. This is the same reason why heart attack pain is felt in the left arm. This is because both parts of the body share the same nerve supply. Talking about the cause of primary dysmenorrhea, the major cause of primary dysmenorrhea is as a result of a substance called prostaglandin. Now, prostaglandin is released in the uterus when the uterus is contracted. Now, when the uterus is contracted, it causes the blood vessels to be squashed, and when this happens, it means that there is less oxygen being delivered to the muscles in the uterus. Now, this can be very, very painful. Now, personally, I have a very low threshold for pain. Like, I do not, no matter how small the pain is, I do not find it very funny. Now, talking about women that suffer from every period or, they have every flow. Now, this can also be very painful because uterus has to contract in order for the blood to come out of the cervix. Now, this could give a very crampy pain, and you guys, it could be really painful. In primary dysmenorrhea, there are usually no complications with the pelvic organ, but there are some other factors that can lead to the cause of this pain. Now, this includes starting your period before the age of 12, being obese, if you're a smoker, or if you have someone in your family that suffers from primary dysmenorrhea, or if you've never had children. These factors can make you suffer from primary dysmenorrhea, although painful period is usually not known to be serious in people who already have children. Now, moving on to secondary dysmenorrhea. Secondary dysmenorrhea is usually caused when there is a problem with the pelvic organ. Secondary dysmenorrhea is usually caused when there is an abnormality in the pelvis. This means there's probably something wrong with the fallopian tube, with the uterus, or with the ovaries. You might be doing just fine at the beginning, at the early stage of your life, and then somewhere along the line, maybe in your 20s or your 30s, you start to feel this pain. The pain might not even be related with your period. You can just feel this pain anytime before your period or after your period. You can feel heaviness in the pelvic area. You can bleed in between your period. You can even bleed after sex. Now, these are some of the signs of secondary dysmenorrhea. I'll be going deeper into the causes of secondary dysmenorrhea. Now, I mentioned that this is as a result of there being a problem with the pelvic region. Now, we're talking about some of the common causes of secondary dysmenorrhea. I'm definitely not going to be going in depth. This video is only for educational purposes only. It is definitely not going to replace you having an appointment with your doctor. Now, one of the very common causes of secondary dysmenorrhea is endometriosis. Endometriosis is really common. This is when the lining of the uterus goes to implant itself outside of the uterus. Now, this is definitely not going to stop the bleeding. It's still going to be bleeding every month outside the uterus, and this could be really painful. Now the second one is called adenomyosis. Now this is not as common as the first one, and this also happens when the lining of the uterus has gone to implant itself where it shouldn't be. It actually implants itself in the muscle of the uterus, and this can also be really painful because it still continues to bleed every month. And the third case I'll be talking about today is pelvic inflammatory disease, also known as PID. Now this happens when the pelvic organ is inflamed, and a majority of these cases are caused by untreated sexually transmitted infection, either syphilis, gonorrhea, any of the sexually transmitted infections left untreated. Now this moves from the vagina up into the pelvic organ. So now, how is dysmenorrhea diagnosed? Dysmenorrhea is diagnosed by the doctor taking information about your family history. A pelvic examination could be done. You could be screened for a sexually transmitted infection. You may have to do an MRI. You might also have to do an ultrasound. Now ultrasound is when the camera is passed right through the belly button to take a look at the pelvic organ to see what the actual problem is. Now, talking about the treatment of both primary and secondary dysmenorrhea, I'm going to be starting from the primary dysmenorrhea, and I'm going to be sharing some home remedies, some tips that could help you if you're having menstrual cramps at home and you just feel like you don't want to do anything. I'm going to be giving you some few tips that could help you to relieve the pain. You can try to position yourself in a certain way. You can try to lay down. You can try to curl up into a ball. This is going to help you, and it's going to help to relieve the pain. The second thing I'm going to be recommending to you today is the heat pad therapy or hot bottle water therapy. Now you can do this by placing it on the stomach. Now while you are doing this, you have to be very careful and make sure that this bottle is not too hot so it doesn't burn your skin. You can actually make sure you're putting on a very thick t-shirt, or you can try to put like a towel in between your skin and the bottle. Now if you do not do this, you can actually get your skin burnt. This is known as a medical condition called erythema abigne. Now this could actually lead to a discoloration of the skin. The next thing I'm going to be recommending is exercise. I know you are like, girl, you want me to exercise when I'm feeling pain. I know it sounds cliche, but I'm not asking you to box or to do this strenuous exercise. Now what I'm saying is that you can do a little yoga, try to stretch, just try to find a comfortable and a balanced position. This could actually really help to relieve the pain. Now, talking of the medical treatment of primary dysmenorrhea, the first one I'm going to be talking about today is the use of Nsaid. Now Nsaid is a non-steroidal anti-inflammatory drug. Now these are your ibuprofens, your diclofenac, and the rest. Now there are some categories of people that cannot take these drugs. Now these are patients that have stomach ulcer, those who have gastroenteritis, people who have kidney disease. They are not advised to take Nsaid. Now talking of diclofenac, ibuprofen, and the Nsaid family, now this has to be used correctly. If you are supposed to take it 3 times daily, please make sure you take it 3 times. If you're supposed to take it just twice daily, make sure you take it twice daily. As soon as you realize that your period is coming, if you're able to calculate it well, if you're unable to calculate it well yourself, you can actually download the Flow app. The Flow app helps you if you are willing to put in the correct information. They are always there to remind you, your period is coming up in 2 days, in 3 days. And as soon as you're already feeling the cramps, you can take this medication even before your period starts. Now this is necessary, and even when you have started your period, it's still advised that you take it if you know that you have really low threshold for pain. Now what this does is that it builds up in your bloodstreams, and it helps to take down the chemical I told you, prostaglandin, that causes the pain in your system. You can try different Nsaids, and you can eventually choose the one that you think works best for you. Remember that people are different, they are different body systems. There's no particular one that you can say works for everybody. You just have to try it by yourself. This is the one that works for you, or this is how you feel whenever you take this drug. And please it is generally advised that you take Nsaid with food, not taking on an empty stomach. Make sure that you take your Nsaid with food. Now the second medical treatment I'm going to be recommending to you today is hormonal contraceptives. This is for people who want to use contraceptive. It's not for everybody, of course. Now, what this does is that it helps to suppress ovulation, which reduces the production of prostaglandins. And of course, when there are no prostaglandins, there are no pains. Now, these are the treatments I am going to be giving you for now. Like I said earlier, like I mentioned earlier, this is not a treatment video. This is definitely not going to replace your own appointment with your doctor. I'm not going to be telling you everything in this video. Now, for the secondary treatment, in addition to all the treatments I've mentioned earlier in this video, remember that for the secondary dysmenorrhea, you have to actually treat the cause, not just the symptoms that you are feeling. I would advise that you go see your doctor. No other person knows you better than your doctor, who is able to examine you personally, who is able to take your family history into consideration, who is able to take into consideration the side effects of the medication, making sure that your medication fits perfectly into the diagnosis meant for you. Please make sure you see your doctor. Do not self-medicate. Do not go online just to go to search for medication for yourself. Make sure that this is recommended by your doctor. Now, if you know anybody who suffers from dysmenorrhea, who suffers from excessive pain, or who probably tends to bleed in between their periods, please make sure you recommend this video to them. Make sure you share this video with your friends, your family. Make sure you share it with a woman. Make sure you share it with a lady. Just share with everybody. Thank you so much for watching this video. I hope you were able to learn one thing or the other from this video. Please do not forget to like this video, subscribe, share it, give this video a thumbs up if you enjoy the content of this video. Thank you so much for watching. I'm going to see you next time. Bye.